Texan Live is out at Memorial Hermann this week for our weekly Doc Talks, talking to Dr. Hodges this week about asthma. Can you tell us what exactly asthma is?
So asthma is a chronic lung disease seen both in children and adults. It's characterized by inflammation and spasms of the airway.
And what are the symptoms?
So typically most kids experience shortness of breath, wheezing, chest tightness, and even cough.
And is it more common in children than adults, or it's kind of the same?
It's the same. A lot of children do have asthma, and sometimes kids can grow out of it as they get older, but it can persist into adulthood as well.
So from a sports side, are there any sports that they would need to stay away from if you do have asthma?
Really, we encourage all kids to participate in any sport that they would like. With that, there is a caveat. Some sports can cause worse symptoms than other. Any kind of endurance sports where there's a lot of running or vigorous activity, certainly we need to watch out for. Also cold weather sports, ice hockey, and skiing, those kinds of sports, because the dry, cold air can exacerbate asthma symptoms. But as long as we have the asthma under control, kids can participate in any sport they want.
And what are some of the treatments for exercise-induced asthma?
So the mainstay of treatment really is the rescue inhaler or the albuterol inhaler. So that any parent with a kid with asthma is familiar with this. They use it anytime they have symptoms. So you take a couple of puffs whenever you start to develop symptoms.
And what would be some of your advice for parents with kids with asthma?
So the main thing is they need to be seeing their doctor and really getting the asthma under control first, because really that's the first preventative step to having exercise-induced asthma, is to have it well controlled. So they may go on long-term medications like inhaled steroids, that kind of thing. Also, just advice for before play, kids, we usually recommend that kids take a puff of their rescue inhaler, 1 to 2 puffs, about 10 to 15 minutes before exercise, and then it helps reduce the symptoms that they have during play.
And aside from any type of medical treatment for asthma, is there anything that they can do nutrition-wise to help with asthma?
So nutrition-wise, of course, just having a healthy, balanced diet. There's been some thought that maybe things like honey and things that protect against allergens and allergies can be helpful. Really, the main thing is trigger avoidance. So things like pollen, fumes, that kind of thing, illnesses, all those things will exacerbate asthma. So just doing the best you can to protect against that. Also, if you're doing things in cold weather, wearing a scarf around the face when you're outside and that kind of thing can help protect from having such bad symptoms.